Alright, so all of you guys have had a vaccine, or like had the flu or strep throat, right? So all of you went to the doctor and said, hey, what's actually wrong with me? So they probably said, oh, you just got some strep throat, here's some antibiotics, you should clear up in a couple of weeks. Well, we are here to talk to you about antibiotics. So all of you guys have had a dose of it, sometime in your life. Doesn't matter if it was right when you were born, they give you an immune booster. All of you guys have had antibiotics. All of you have it raging through your system. So we're going to talk to you about antibiotics, its advantages, disadvantages, its development, some of the history behind it. But first I want to give you guys a quick overview of the history of overall medicine. Alright, so medicine's just been around. We've got different names for it in different places. Hippocrates started it around 460 BC. He was one of the first sort of doctors. He prescribed a form of aspirin to his patients. He's considered the Greek father of medicine. Actually, his Hippocratic oath is still used today as for doctors. Along with Hippocrates, another Greek was Theophiles. He wrote the first anatomy book. The Hippocratic oath has been modernized for use today. So this is a short piece of it. It says, "I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially, I must tread with care on matters of life and death. If it is given me to save a life, all things. But it may also be within my power to take a life. This also responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I'll remember that I do not treat a fever chart, a cancerous growth, but a sick human being, whose illness may affect the person's family and economic stability. My responsibility includes these related problems. If I am to care adequately for the sick, I'll prevent disease whenever I can, for prevention is preferable to cure." And a quick overview, most of medicine didn't really pick up until late 1800s, early 1900s, and most of the inventions were like microscope through the 1500s. First appendectomy, the successful one, was also during the late 1600s, early 1700s. The first vaccine, which was for smallpox, was invented in 1796 by Edward Jenner. And in the 1800s, we have the first medical equipment that are also used today, the syringe, the stethoscope, the first successful blood transfusions, and they actually identified that bacteria was the cause for all diseases. As it goes on, we move aspirin, and then the EKG machine, and Band-Aid was actually made after the EKG machine, go figure. And then insulin was used to treat diabetes. And after all of that, in 1929, a Sir Alexander Fleming created penicillin, which is where I will let Amanda pick up the development of penicillin.
Okay. The antibiotic penicillin was first discovered by Alexander Fleming in 1929, who was a professor at St. Mary's Hospital in London. The way he discovered it was actually by accident. He was going on vacation, and one of his co-workers wanted to use his work bench, and he had a bunch of petri dishes piled up, so he just moved them all to the side. And on returning from his vacation, he was going through all the petri dishes, and he noticed that there was a certain kind of mold growing in the petri dishes. While going through it, he also noticed that the mold had killed a certain bacteria that was in one of the petri dishes, which is a staph bacteria, which caused a lot of diseases and things like that. He then realized that the mold had potential, so he started running further tests and things like that on the mold, and he started testing it on other harmful bacteria and things like that, and he noticed that the mold had actually killed all the bacteria and that it was non-toxic. After discussing the mold that he discovered with a mycologist, which is a mold expert, they said that the mold was said to be a penicillium mold, hence the name penicillin. Though him and the mycologist knew that the mold had potential, Fleming wasn't an actual chemist, and though he knew that the mold had potential, he wasn't an actual chemist and wasn't able to actually isolate the active bacterial agent inside the mold and couldn't keep it long enough to run further tests and actually turn it into a medicine. He recorded his findings into a paper, but it didn't grab any attention from any other scientists. About 12 years later, during the Second World War, two scientists from a university went ahead and took the mold penicillin and started running new scientific techniques and things like that, and they were able to create a brown powder which actually kept the penicillin mold alive, and they were able to actually create it into a medicine where it could be used for humans and things like that. And like I said, that was during World War II, where people, soldiers and everybody were getting injured, and there were like any kind of little cut or any kind of infection was thought to be fatal. So needing the new drug immediately for World War, mass production started happen, and they got the drug out to all the soldiers and people during World War II, and it saved so many lives, so that's where they got the name miracle drug or wonder drug. But during those times, penicillin it was only used for military use until about 5 years later, when it was actually mass produced for the United States and things like that. So now Jean-Paul will explain to you about the everyday uses about the antibiotics.
All right. Personal uses of antibiotics. Antibiotics are not only found in pills and medicine, but there's also other products that do contain antibiotic properties or even antibacterial ingredients. For example, hand sanitizers, antibacterial soaps, toys, mattresses, cutting boards, socks, slippers, sheets. All of those things contain some kind of antibacterial, antibiotic property, ingredient, or product. So we are in contact with them every day. So it's not only just in pills. I used to, little story about myself. I used to be kind of a germaphobe, and I used to like hand sanitizer all the time. But I stopped. Like every time I touched something like ice, that was like dirty, I used hand sanitizer. But well, anyways, yeah, we are exposed to antibiotics, antibacterial materials every day. Okay, so I'm also going to talk about some diseases that have been prevented and treated by antibiotics. First one is meningococcal infections. It is a contagious bacterial infection caused by Neisseria meningitis. It has high fatality rates, up to 15% for infection of the central nervous system. Also known as the infection is also known as meningitis. Can cause bloodstream infection, severe neurological deficits, and antibiotics are used to treat this. Those are three of them are ciprofloxacin, penicillin, and ceftriaxone. Those are used for prevention. That's the main role of these antibiotics. Next is communicable diseases. It's an illness caused by a specific infection agent or of its toxic products. It arises through transmission of the agent or its products from an infected person, an animal, or an inanimate reservoir to a susceptible host, either directly or indirectly. Antibiotics kill this agent and renders it non-infectious. Some ways to prevent communicable diseases is by washing hands, preferably antibacterial soaps to be exact. Adequate use will develop resistance to this disease over time, and antibiotics in general, and also to communicable diseases, have a widespread effect. and may be affected to a certain number of microorganisms. Then finally, diphtheria. It is an upper respiratory tract illness caused by Corynebacterium diphtheriae. It's a facultative anaerobic and gram-positive bacterium. It is characterized by sore throat, low fever, and an adherent membrane on the tonsils, pharynx, and nasal cavity. If it progresses, it spreads through the bloodstream, causing life-threatening complications to organs such as the heart and the kidneys. Antibiotics are used in patients or carriers of this to eradicate the C. diphtheriae and prevent its transmission to other organisms. Antibiotics that are used to treat this disease is, as you see there, procaine penicillin G, metronidazole, and anthromycin. It can be either orally or by injection, the anthromycin. The anthromycin is used for 14 days to treat this disease. And yeah, those are 3 examples of diseases that have been prevented and treated by antibiotics. Now I will show you a video by Dr. Oz. And he talks about Macana honey, which is a natural antibiotic, and just how it treats a certain illness or a rash or something on this person's body that you will see in the video.
Instead of writing to the doctor for prescriptions, our natural antibiotics, they can be your first line of defense when you get sick. Today I'm sharing cutting-edge natural antibiotics from your local health food store to help heal you. Joining me is natural medicine expert Peter Ladudice. I think I'm welcome to the show. You got natural antibiotic remedies. Tell me about why these are so special. Why do you prefer these?
These herbs are incredible because they have amazing healing benefits for common infections.
That's when we're overusing antibiotics all the time. So if you're not sure if that's worth what you can treat or not, good place to start. Okay, Joanna from our audience is joining us. Joanna, come on. So how are you doing? Welcome to the show. Alright, so let's get real here about antibiotics. Give me a classic kind of scenario that would prompt you to take antibiotics.
Well, I'm very prone to sinus infections or colds ever since I moved here. So if it gets very bad, then I would go to the doctor and he would prescribe some kind of antibiotics.
So how many times a year do you take antibiotics?
Not that often. Maybe once or twice a year.
Okay, so I thought we could indent that number down if we want to. So
That'd be great.
Take it away. I want you to write down what we're talking about today. We got a world expert here teaching us. These are things you may not already have in your home, although some of them you may. I want you to get them in your home, put them in the medicine cabinet, and when you have some of these very common ailments that we're talking about, you can take advantage of some of these insights. So the first natural antibiotic, it helps with cuts. It helps with scrapes. And you know what? It's honey, but it's a special kind of honey called Manuka honey. Peter, why does it work?
So Manuka honey comes from the Manuka tree from New Zealand. So I want to have you both give it a try because it actually tastes very yummy, a little bit stronger than regular honey. But do note that this is a honey not to keep in the pantry, but to keep it in the medicine cabinet.
Why is it different from regular honey?
Just because it has a stronger antibiotic component to it.
It's good. Yeah, they put it on bread too.
And actually, really, it's good to put it on bread and it's great for you.
So how do you apply it?
So what you want to do, if you do have any cut or wounds, you want to use about a tablespoon of the Manuka honey. So we're just going to apply it topically just like that. And then what we're going to do is wrap it up in a gauze as you would any wound. And then you want to change this dressing 3 times a day.
You apply it 3 times.
3 times a day. And then the amazing thing is there actually now companies that...
So there you go. That's an example of an antibiotic. So now, there is, though, a downside to antibiotics. And here's Justin to explain more about it.
Downside of antibiotics. Everybody has heard of or has known about staph infections. Well, the biggest downside is MRSA, which is methicillin-resistant Staph aureus. It is a very resistant form to the regular staph infection. That right there is a picture of what methicillin-resistant Staph aureus actually looks like. I have personally had 2 outbreaks of MRSA. One was on my ring finger here, and the other was right here on my face. The wound actually is really warm to the touch, and it actually caused swelling. And when it got on my face, I had this whole side of my face swollen shut. I couldn't even see out of my right eye. The other downsides to these overuse of antibacterials is the fact that it's causing more common bacteria to be even more resistant. You've got anthrax being one of them, where the resistant form of anthrax is really a hard thing for any doctor to treat. You've also got tuberculosis, malaria, pneumonia. There's a little catch about pneumonia. Antibiotics don't work for viruses at all. They do not. So when a doctor gives you an antibiotic because you have a cold or actual pneumonia, he's only treating the infection caused by it. He's not treating the actual viral infection. Okay? The other downside to us overusing antibiotics is the repeat doctor visits because the current prescription is not working well. The increased cost because you have to get a stronger antibiotic. The overall thing is, we ourselves as humans have overused these products so much that we actually gave birth to these resistant forms of bacteria. The other downside to antibacterial products is you've got 2 main ingredients that's mostly in hand sanitizers, antibacterial soaps, hypoallergenic products like sheets and that. You've got triclosan, triclocarban. Those ingredients will destroy both the bad bacteria and the good bacteria. So in essence, you're actually leaving yourself more susceptible to other infections. Alcohol, your skin naturally produces an oil to protect itself. Okay? And what alcohol does is it strips the skin of that and it dries your skin out, leaving you susceptible to infections. The biggest thing on how antibiotics work is they inhibit the growth of the bacteria. They basically smother it to death. But it doesn't kill 100% of all bacteria. Every time you look at like Lysol, it says kills 99.9%. Well, yeah, that's because that 0.1% of the bacteria managed to survive the product that you used. Hence, it replicates itself, making it even more resistant to whatever product you used, and ultimately, there you go. We got more resistant forms of bacteria. To better protect yourself against having these things, Patricia here is going to explain what you should and should do all the time with your antibacterial products.
Alright, so the first thing to preventing antibiotic misuse and more importantly preventing pathogen resistance is to understand when antibiotics should be used. As Justin said, antibiotics are only useful against treating bacterial infections such as meningitis or strep throat, but they're useless against viruses such as the common cold, the flu, or bronchitis. And this leads directly to my second point, which is don't pressure your doctor into giving you antibiotics. Doctors have to go through 10 or 12 years of schooling just to become one. And in medical school, doctors are taught the phrase crimen non nocere, and that's Latin for first do no harm. And that's part of the Hippocratic Oath that every doctor must swear before they become a doctor. So most doctors will always suggest what is best for you. So don't go into your doctor's office with a cold or a cough and ask him for some penicillin, because that penicillin won't do anything for your cold or your cough. The best thing to do when you have a cold is just to get plenty of rest and fluids. And if you have something more serious like the flu, your doctor would prescribe you an antiviral medication. is to always take your medication correctly. This one's kind of obvious, but I've been guilty of not taking my medication correctly. I would have strep throat or something, and I'd have to take some medication for about 5 or 7 days. And I would only take it for about 3 days because I start feeling better after 3 days. But only reason why I'm feeling better is because the sickness is getting weaker, but it hasn't left my body. So when I stop taking my antibiotics, the sickness has time to recover and become resistant to that antibiotics. So now I'm sick again, and I have to go back to the doctor for even more antibiotics. So the fourth point is to just get vaccinated. Getting vaccinated will prevent many of these bacterial infections from affecting you in the first place. And I know there's been some controversy over vaccines lately. Some people believe that vaccines can cause autism, but the Center of Disease Control says that there's no link between autism and vaccines. We don't know what causes autism, but it isn't vaccines. So please get vaccinated, and if you ever have any children, please get them vaccinated as well. So to wrap things up, antibiotics have revolutionized the medical world. Diseases like meningitis used to spell death forever for anybody that caught them. But thanks to the discovery of penicillin, and more importantly, the discovery of antibiotics, people are now able to survive these once fatal diseases. However, the introduction of antibiotics into modern medicine has caused problems. The overuse and misuse of antibiotics are directly responsible for the creation of deadly staph infections such as MRSA. And people who do not take their medication correctly just end up making bacteria more resistant to current antibiotics. So, and this isn't a problem that only doctors and scientists can solve. We all play a role in stopping antibiotic use. Thank you.